speaking is providing the structure. How we are going to provide the structure? You will get only 5 minutes to complete your role play, right? From top to bottom, you have to finish within 5 minutes. So make sure that whenever you follow the role play, make it in a purposeful, logical, and in a sequence manner, because first you complete the first point, don't rush it to the third or fourth point. Go in a sequence way, because the person who is sitting next to you, interlocutor, he is also having the same role play card. Because of that reason, we should not miss any point from the role play card. Make it in a purposeful, whatever the explanation you are giving towards the patient, make sure that it is correct to your knowledge, and it should be evidence based practice and clinically proven. Okay, so do not use irrelevant things in your speaking. Make sure that whatever the task you are getting in the speaking, that should be clear enough. And whenever you are telling information to the patient, take feedback. Don't forget to take feedback always. The fourth point is information gathering. How we will gather the information? Suppose if I want to know something from the patient, how we will come to know? For this, what you have to do is, there is specifically written in the task that explain, confirm. There are some sort of words you will find there. Whenever the patient is telling something to you, make sure that you have to listen carefully. Okay, being a good nurse, we should have that capability to listen carefully. When you listen carefully, then only you will come to know what is the exact problem of the patient. Okay, whenever the patient is talking towards you, do not interrupt. Let the patient talk completely. Okay, this is how you are going to follow overall the role play. Okay, do not interrupt the patient at any cost. And whenever you are going to ask any questions to the patient, make sure that it is open-ended questions, that is WH questions. For example, I can tell you pain. If you ask the pain means, ask pain scale. If I give a pain scale from 0 to 10, how much you will score to me? How much? Okay, and could you please tell me where the pain is located, whether the pain is burning or pricking or whatever. Okay, ask the WH questions always. Okay, open-ended questions is what we can call. At the end point, the last point, I would like to tell you that suppose if the patient is discharging, if the patient is going home and your role play is about to finish, during that time we have to give some sort of discovering the further information. How we will tell about this? We can tell in the form of leaflet and discharge, appointment, complication. For example, if you take complications, suppose if a patient is undergone for the total knee replacement surgery, so patient will ask about any complications, whether they are going to have. It's better you can tell. Okay, if you have time during your role play, you can tell that, Mr. John, as you have undergone for the total knee replacement surgery, let me tell you, once you get discharged from the hospital, if you got any problems within 24 hours, like any complication if you face, like excessive bleeding or swelling and any other sort of complications, make sure that you have to take an appointment and meet to the GP. Okay.